Hello, everyone, and welcome to ReviyalyzeMD Sex Bites podcast with me, your host, Dr. Deborah Durst. So today we're going to talk about 4V laser treatment, and we'll tell you what that's all about. But for now, I'm going to let my guests introduce themselves.
Hi, my name is Meredith Wallace, and I work for Dr. Durst, and I'm a skin specialist and mainly do a lot of the laser technology.
Hey guys, my name is Ferda Golombieski. I'm a family nurse practitioner and I work at ReviyalyzeMD and do most of the wellness stuff.
Hello, I'm Marissa Staten. I'm a medical esthetician and laser technician.
So I am going to look towards Marissa and Meredith on this one too to join in. So recently we do what's known as a 4D laser treatment. So it's a 4D nonsurgical facelift, and it's a laser treatment, and it's fabulous. It's 4 laser treatments in one that does a non-surgical facelift, and it is my most favorite laser treatment. So recently we were at a conference. We love, learning and going to conferences, and we didn't expect this addition to the practice the next week when we were back, but it's the 4V laser treatment, which is a 4-step laser treatment on the vagina. And that's something we learned at the conference. And so again, it's not something I had thought about prior to the conference,
Bigger,
right?
better, greater.
Which is really surprising.
Yeah.
Bigger, better, tighter. I know. Like I'll do and inject and put lasers and all kinds of stuff where you would never think about putting things. But I hadn't thought about this one, but it was a fabulous idea. And so
it's a great addition to everything that we're already doing. So it'll be great to pair this with other things and do it in addition, although we can do the internal portion of this like we do with the face. And we can use that, but we can also just pair it with the Votiva, pair it with the O-Shot, have just a whole comprehensive approach to
Don't forget about the 4-minute
that
treatment.
area. That's right.
Yeah.
it's as comprehensive as can be now. So I will just say that, so before when we did, because our Fotona laser machine is the laser machine we're talking about. It's a beast of a machine, does 170 different laser treatments and 2 wavelengths, and we can dial in and out and do all kinds of stuff. So fabulous treatments, all the things, we can do everything. But when we did vaginal, because it does do the vaginal, so if you have urinary incontinence, decreased orgasmic strength, which we get with age, perimenopause, menopause, hormonal decline, childbirth, all of the above.
All the things.
Yeah, all the things that we would do this treatment. And it's a robotic, so it's more uniform. It's different than our other laser RF device that we use for the same services. But when we would get to the outside, I almost looked at Votiva or our RF device as a more tightening on the outside, and our Fotona with the erbium doing more of a skin lightening, brightening, bleaching kind of, which is also a very sought after treatment.
Yeah.
But until this treatment, and so now with the 4D, and we'll talk a little bit about those 4 steps, now we have an amazing tightening on the outside as well. So the 4 steps, which one wants to start with?
Marissa, you want to start? The best
fabulous
part,
4 laser treatment
we can
in
do
one.
it together, but I feel like because we just recently changed the way that we do the 4D face because of a conference that we went to, using a lot of the tight sculpting settings that we weren't doing before. We were using a totally different handpiece. Now we're using a different handpiece that we actually use for tight sculpting, the T-runner, L-runner, larger handpiece at the scanner that we use. So it really tightens a lot more, which we were not getting as great of results with the 4D as we are more recently, I feel like, because we're doing that tight sculpting with it, basically. So we're literally doing everything we could possibly do with the face kind of all at once, all in one treatment. And I just did my first one on the neck as well. And with adding the tight sculpting has just made the world of difference because you're getting so much more tightening. So you're having more heat, more tightening, lifting, firming. So we've gone downstairs, started it there. And Marissa, do you want to talk about maybe the first couple and I can
So
pick up
even
wherever.
before we do, and we don't have to, like, again, it'll be pretty basic, because
Yeah.
they don't know, like, the...
we can
but
get into more extensions
and
later on.
just for clarification, because we're not in there doing it all the time, although I think sometimes I feel like I have a decent, at least overall handle on it,
absolutely.
even though I'm not doing it. But so when you're talking about tight sculpting, again, that's when we're doing body
Contouring.
But for that, we're doing kind of a decreased fat skin tightening, and she's talking more of just the skin tightening.
Right.
But we're talking really about a scanner that's more robotic and covers more area and faster, right? Is that
That's
a
exactly
safe
what
way
we're
to
doing.
say it? Okay.
It's better in the fact that we are able to dial the time down a little bit, cover a larger area, and maintain that heat longer in a larger area.
Okay, yeah.
So that's
more
basically the
effective
difference.
treatment.
More effective, and we're basically incorporating 4D facelift concept with tight sculpting, which is basically, like you said, it's just changing the hand pieces to a larger hand piece to cover more area.
Larger, like robotic, where
Yeah.
it's knowing what the
And less
temperature is,
yeah,
let you
and
know
less movement
feedback.
for
Yeah.
us.
Yeah, so it's less of a manual and more of a, like, I'm going to put the
Uniform.
robot there,
It's got
and
it.
I'm going to get the temperature and treat this large area and faster, right?
Yes.
And of course, better results because of it. But okay, I just was trying to just clarify because it's like
Yeah.
progressive in the way, like it's better for us, it's
Right,
better
it's
for
kind
the
of all
patient.
new. Yeah, it's easier and better for
Win-win
us,
all around.
and they get better results, and it pretty much takes about the same amount of time. So
Yeah. Love
it's
it.
a win-win-win.
Win-win, exactly. And as far as that goes, step one is focusing on the introitus area. So you're tightening from the inside, almost like the first step of 4D, which is intraoral, except for for the 4V, we're not actually inserting anything into the vagina, so it's all exterior, so think that way. And then step two is going to be, actually we could even incorporate laser hair removal during this step. It's amazing because you're actually going to be tightening the exterior, and if
there's
the
hair
person
present,
wanted it or needed it, yep. we're
Faraday
gonna
and I
get it.
both need
It's gonna be
that.
gone.
Yes.
Yeah. Well,
Another treatment, my friend.
it's a whole nother podcast.
I mean, I think everybody here would be like, put me on that list when you get a free minute.
That's just bonus. That's just bonus.
And we have like fabulous hair removal treatments, but we don't always take the time to get
For
on
ourselves.
the table to do it ourselves, which is sad. So those maintenance things we're not good at. So anyhow, but I love that idea.
Yes.
So, just saying.
So we could add a couple more steps in with
Not
the
the only
4V as bonus. But step 3 is going to be the rejuvenation. So that one is where we're using a larger handpiece, and it's covering a larger area, and it's stimulating as well. We can also incorporate the clitoral stimulation at this point as well with the 1064 nanometers. So that is
4 minutes to better foreplay. If you've seen that podcast, that's what she's talking about.
and I mentioned 4 minutes again.
She
Remember
actually
that.
became famous with that because recently we had a patient in that said, I feel like I know Marissa. She just kept repeating 4 minutes. Did I say 4 minutes? Yeah. That's all it
4
takes.
feet, 4
Yeah.
minutes.
Yeah.
4
So-
minutes, 4 something to your best
Yeah.
sex life.
Yeah, so there's so many different, things
Yeah.
we can add. So then,
Then we're going to tighten.
and then you're
Tighten
gonna
even
tighten.
more with the 2940 nanometer. It's going to cover a larger area also with the larger handpiece, which is the T-Runner. Amazing results.
Amazing.
Unbelievable.
And we saw
I-
them this week, like
Yeah.
blown away.
Yeah.
Blown away.
These
Just
will
what
be
one
published
treatment.
pictures, I'm
Yeah.
sure,
Yep.
at this point.
Well,
So
we
there's that-
are,
there's that tightening
So
part.
look
And then
for
the
pictures to
last-
come, peeps.
And then the very last step, of course, which technically I guess it makes it
A fifth.
5 almost. It's basically a 5V now. So then we resurface
Yeah.
as the last step. So,
And that's
Very
the
mildly,
brightening,
and it's-
lightening.
Yes.
yep. So just like
So
we do
you're
on the
doing
face.
an introitus or the vaginal opening, not inside, first step. You're doing the hair removal, again,
Heat.
step 2, and then
Hair
you're doing
removal.
3 as the tight sculpting.
Tight sculpting,
And
and
then
then if you want to do
the
the
clitoral,
clitoral
and then-
stimulation
alright.
after that, and then there's the lightening, brightening, and resurfacing.
yeah, wow.
So it's
It's so many things all in one.
Yeah.
And each step actually does multiple things. It just has a little bit of a focus, and you'll love it.
and
Rejuvenation,
I love
top
it.
to bottom.
Yeah.
and we can really do all of those steps in about 60 minutes. So And with no, we don't have to use numbing either for this. We can just for the last step to be a little bit more comfortable, but we really don't have to use numbing. So you can basically be in and out, within about 60
And part
minutes.
of the treatment, we can use the simmer, which blows cold air. So if there is a little discomfort with heat, it'll take care of that.
Yeah.
So.
What about downtime, ladies? Is there any downtime with this treatment?
Not really. We tell people kind of play it by ear. We wouldn't really recommend, because of the resurfacing aspect of it, we wouldn't recommend them being sexually active that same day or that night. But by the next day, if they get the urge, then hey.
So like
it's comfortable
resurfacing with
for
the
you.
face. Be nice to
Basically,
it for 24 hours and then you're good to go.
Basically, yeah. Don't go out naked.
So it's like
The
resurfacing.
4-hour rule.
So I actually didn't
4
think about
hours.
this until right now, but it's like resurfacing with the face and oral sex. You could still have oral sex if you had resurfacing, but do you really want to?
Right.
You're red, you're tight,
Exactly.
you're sore, and you don't want anything rubbing on the outside. So it'd
Exactly.
be kind of the same because it's not an internal treatment and it's an external, so kind of
Yeah.
the same.
And I
You
haven't
wouldn't go
had
to-
any
Exactly.
complaints with anyone so far as a burning sensation on the exterior afterwards, especially the resurfacing side of it. But, as we said, play it by ear. It's your comfort.
Yeah.
However, for whatever reason they didn't do a resurfacing, no downtime.
I wouldn't
Is that
even
what
say
you're
4 hours. I'd say probably ready in 4 minutes.
Okay, well there we go.
So the clitoral treatment that is one that, again, does tend to engorge and bring stem cells to the area. And so women do tend to want sex after just doing a clitoral one. And so, again, keep that in mind, ladies, when you're deciding whether you want to add that one on to your 4V or not.
If you want
based
your
on it. But if
5V.
you're- but if you're down there, but it's not internal, so it's not going to tighten the vaginal canal. It's not going to work
Correct.
on urinary incontinence, orgasmic strength from the outside, but clitoral orgasmic strength.
Yeah, so
of
that's
course,
why we're
yes.
still recommending the radio frequency first. If that's an issue for you,
Which would be
incontinence-
Votiva.
right? Which is the Votiva. If that's an issue for you, then again we can pair all those treatments together, do them all in the same day, even so.
And we do have a vaginal treatment with Fotona too. Again, it's more robotic and so uniformly heats, and so it's with that same device. But we do a lot of the Votiva as well. So we have lots of different options in the office. But now we have, internal and we have external. So we have G-spot internally if we're doing one of those treatments. But then again, this 4V is going to be clitoral with a complete makeover in your vagina, right? And
Lighten,
the vulva,
tighten,
technically,
brighten.
but lighten, brighten, tighten, and so
Yeah.
even lightening
And
is a big,
And stimulate,
and
yeah.
stimulate. Yeah, you can't forget.
Can't forget that one.
girl. Yeah, 4 minutes.
What was I thinking? Gosh, how could I forget that?
4 minutes.
4 minutes.
Go ahead. Can you repeat?
Can I repeat that? Everybody got it. 4 minutes.
Yeah.
4 minutes. We put the 4 in foreplay.
So I'm going to say that we are going to have before and afters somewhere. We will probably have them on at the very end of the video on YouTube if we can do that, because it's amazing. So we did our first one last week, right? Yeah. So last week. So again, we were just back from the conference, and actually our machine, because we use it so frequently, had, to be serviced, and we had to have, a flash lamp replaced. But having said that, so then it was
Great.
back in service right after that. So we did our first one. And this lady was walking around the office more than happy
To show her pictures, and they were
pictures.
amazing.
And she said,
Yeah.
normally I would not tell you to go look at my pictures, but you need to go look at my pictures. And so she was very excited, and so was I. Amazing.
How
before and
soon can I
afters.
get access to these pictures?
Yeah.
Well-
and this was right after. So
I learned pretty quickly when Dr. Durst come up to me with an iPad. She's like, "Look at this. I never really know 100% what I'm going to get, But it was full screen before and after. I'm like, that
Look
is
at this
awesome.
vagina.
That
Yes.
needs to be on the internet somewhere.
yeah.
So
Yeah.
maybe on our website.
Well,
or
there's not
if
anyone
we
that
can.
hasn't looked at it that hasn't said, I'd be proud to show that one off too.
Yeah,
And
right.
so everyone has said that. So we're going to put it probably, if we can, at the end of the video. We'll just check, technically if that's, what we need to do that. And then it'll be on the website too. But we definitely want to show those amazing results. So anyhow, great treatment. I'm like, and again, I sent it off to the doctor that like kind of, taught us how to do it, and to give him a little warning, of course, okay with the, the patient, but I had sent him off, but I said, incoming before and after of the 4V, and so,
He was so
that
jealous.
he knew.
I don't get warnings like that. I get, hey, look, it may be an email, maybe a vagina.
Yeah, exactly.
You know what I loved about the picture? It was exactly 1 hour after the treatment.
Yeah.
So the before and after is exactly 1 hour later.
Correct.
Exactly.
The next question would not only just downtime, but is it painful? And we talked a little bit about that, but the patient also said it was completely comfortable.
Yes.
So those results with no downtime and no discomfort or no significant downtime, again, because it's new to us. And I mean, I would say, definitely, between 24 and 72 hours is safe. Just depends on the clitoral.
And then what you're comfortable with and how you feel.
Absolutely, yeah. If you're comfortable, there's no there's no adverse effects to doing it sooner. So it's all personal preference.
You're not going to have any any bad outcomes from it, but just discomfort. If you're feeling discomfort, then don't. If you're feeling engorged, then do. So, all right. Well,
Tell us all about it.
Yeah. So, any other questions, or anything we haven't discussed with it? So, I think otherwise, no. Just this is all external 4V. A lightening, tightening, brightening, stimulating of the vaginal area, the vulvovaginal area, so external. And then, again, if we're doing urinary incontinence or orgasmic G-spot, then or vaginal tightening, then we're doing internal treatments, and that's something additional. Yeah, either Votiva or the Fotona one too. So, and then the clitoral treatment is something all of our women love. Yes. The 4 minutes. The 4 and foreplay, they love it once they have it done, and so that's something that you can also have. But I would recommend, at least 3 of these in a series usually, because it's cumulative, and just amazing at just tightening up that external area and just the appearances.
It's really amazing. It really is.
So, yeah. Well, anyhow, so definitely let us know your comments, and you can't I'm pretty certain you can't tell us about your experience with the 4V because it's new.
And not anywhere else here.
Yes, but let us know anything, any questions you might have. Share it with your friends, and definitely let us know if there's anything else you want to talk about. We're here to revitalize your look, your health, and your sex life. And of course, thank you for coming and sharing the 4V information with us, and then we're willing to deep dive into anything sexual wellness, so just let us know.
And if you don't know about the 4 minutes, just ask.
Yeah, absolutely. And there's another video on the 4 minutes to better foreplay, so please take a look at it. So subscribe, hit the bell.
Ding, ding.
Yeah,
Ding,
I was going
ding.
to say no bell sound. All right, thank you so much.